Okay, so on a lighter note, let's talk about being sick. I'm sorry if you've just got up and you haven't even had your breakfast yet, but we need to talk about hyperemesis because it can actually be a dangerous condition. So nausea and vomiting in pregnancy, fairly common. About half of all pregnancies, women will suffer some degree of nausea and vomiting, and the degree varies hugely. It's usually around worst at about 7 to 12 weeks gestation, and it can vary from mild nausea to hyperemesis gravidarum. Why does it happen? Well, we know hormone levels have an effect. HCG, human chorionic gonadotrophin, estrogen and progesterone. Progesterone relaxes smooth muscle, and the whole of the gut from the mouth right down to the other end is smooth muscle. And we know that the effect of progesterone on the cardiac sphincter at the top of the stomach causes this to be slightly slack in some women, and gives them a constant feeling of nausea. It also explains the early constipation of pregnancy, this smooth muscle effect of progesterone. There's also some ideas that the levels of the hormones themselves might not just be the responsible factor. It may also be that some women are more sensitive to the effect of the hormones on the brainstem, which has a strong influence over nausea. And we know things that make it worse are fatigue, stress, and emotional factors. So these are all warning factors and things that we can help with advice. From the TCM perspective, it's thought to be disorder in Chongmai, penetrating vessel. This can lead to rebellious qi, which affects the descending of the stomach qi, leading to nausea and vomiting. Treatment is chosen individually. There are other patterns of disharmony that usually come into play, so I guess you're always one step ahead. If it's a patient that you've been seeing pre-pregnancy, you might have a good idea of her constitution, her constitutional makeup, and things that she may be more prone to. But other patterns of disharmony include stomach qi deficiency, stomach deficiency with cold, stagnation of liver qi invading the stomach, stomach heat, accumulation of phlegm, and heart qi deficiency and heart fire. And research studies have shown that use of traditional diagnostic patterns was more effective when compared to single point formulated treatments. For instance, studies that have just used points such as pericardium 6, or with patients who may come in and say that C-bands don't help. We know that if you individually treat and address any other syndromes that are going on, you're going to have much better results. So, in terms of treatment and advice, these women are going to need treatment once, preferably twice per week. We usually leave our needles in about 20 minutes. We keep the points to a minimum. It's a principle we use for most pregnancy conditions. And we use ear press needles or ear seeds, or wearing C-bands on the wrist in between treatments. We advise women to eat little and often to stabilise their blood sugar. It's no good these women just having 3 big meals a day or trying to have 3 big meals a day. Fluids are very important, and we recommend soups. They're nutritious, they're more easy to digest, they're warming, and they're more tolerable. The argument goes on over ginger or peppermint. I don't know about in your countries, but here we have an ongoing problem with midwives telling all women with nausea and vomiting to have ginger. And of course, when we look at patients' tongues and see a huge amount of heat, ginger is the worst thing for them. So we have actually published an article in midwives' journals to try and highlight the difference between how some women need warming up with ginger, but some others may need cooling with peppermint, for instance. And they should be advised to seek help if they're dehydrated and they can't stop vomiting. I'm still covering nausea and vomiting here, excuse me. Considerations in the treatment room. I guess a lot of you are aware of this from your experience already, but particularly important for hyperemesis women. Things like smell. If you work in your own home, not to be cooking strong food downstairs or wherever near your clinic. These women are terribly prone to sensitivity to smell. So having strong garlic and onions and other smelly foods cooking is not a good idea. Having a bowl handy, very simple, because these women can actually throw up at pretty short notice, which is a bit alarming. And tissues, a glass of water, the usual sort of courtesies. But we need to think also about position, treating pregnant women. The fact that they can't lie flat, not so much in this early stage of pregnancy, but certainly later on. Ventilation and other smells, such as if you are used to using aromatherapy burners in your clinic, that may need to be a factor to think about for pregnant women with hyperemesis. And we advise them to get as much rest as possible. This isn't difficult when they've already got children, but we know that it makes a difference. And sometimes they need a bit of a talking to about work. They may actually need to invest in some time off, go and see their doctor and be signed off. In my experience, acupuncture can, if not sort out the problem, but at least can give them a window and give them back some control of their life, because this can certainly take the control away and they don't feel that they can function. But it needs to be reminded to them about investing in a little bit of care of themselves. Just because they're in early pregnancy and there isn't a bump to show, they still need to be very kind to themselves. They need to invest in going to bed early. They usually do because they're so tired. But I think we have to get a bit bossy with them sometimes. They will recover much more quickly.